So welcome to the Interagency Standing Committee event on protection from sexual exploitation and abuse, including the challenges we're facing now during the COVID response. The purpose of IASC events is to facilitate dialogue on key issues to support more effective, timely, and appropriate humanitarian action. Again, we will be monitoring the chat box, so please do let me know if there's an issue with the sound and if you have any questions. You can let me know if you can hear now. People in the chat box, a little thumbs up would be great. Yes, can you hear now? Great, thanks. So let me introduce our speakers today. We have on the line Diane Goodman from the United Nations High Commissioner for Refugees, and Andreas Mlitzke from the World Health Organization. Diane Goodman, Diane, can you say hi? On the screen? And I probably have to unmute you. Or maybe Diane is the United Nations High Commissioner for Refugees Senior Coordinator on Protection from Sexual Exploitation and Abuse and Sexual Harassment. Diane previously served as UNHCR's Deputy Representative for Europe during, Deputy Director for Europe during the refugee and migrant emergency in Europe. And she was also previously Deputy Representative in Nepal, and has had many previous experience with UNHCR in Sudan, Rwanda, Tanzania, and Kenya. Diane has also helped civil society organizations and NGOs on human rights, refugee and women's rights. And we're also welcoming Andreas Mlitzke. Andreas is the Director of World Health Organization's Office of Compliance, Risk Management, and Ethics. He's in charge also of the organizational whistleblowing policies, the Integrity Hotline, protection from sexual exploitation and abuse and sexual harassment, corporate risk management. He has also worked in the Office of Internal Oversight Services in charge of sexual exploitation and abuse investigations in the Democratic Republic of Congo. Prior to joining the UN, Andreas has worked for the government of Germany, where his portfolio included the International Criminal Court and legality of the use of armed forces. So hello, everyone. Good evening from those calling in from Asia. Good morning from those in the Americas. And good afternoon for those in Europe. Let me start with a question for Diane. But before I do so, again, reminder, please stay muted. And please turn off your video unless you're speaking. It'll help us see the speakers. So Diane, the United Nations High Commissioner for Refugee, Filippo, is now the IASC on this topic. So you've been championing some specific initiatives to strengthen protection from sexual exploitation and abuse. Would you highlight some of the key initiatives for our audience today?
Okay, thanks very much, Wendy. And it's, hi, can you hear me? I'm getting indications that people can hear.
Diane, you have to unmute yourself.
I unmuted myself and then it went back to mute. So first of all, thanks, Wendy. Thanks everybody for joining. I mean, it's incredible how many people are online from the field, including countries where I've worked. So it's great to be here and I really appreciate your participation and engagement. I'm going to talk about a few of the High Commissioner's championship initiatives, but I really want to mention at the outset that these are really collaborative products. We've really been working in collaboration with a lot of agencies in bringing these forward. Maybe we can mute because I'm getting a lot of noise. So if people can mute, that would be great. So the championship is focusing not only on sexual exploitation and abuse and sexual harassment as well. So I think that's important to bear in mind because unless we address the root causes that underlie both of them, we won't, which includes gender inequalities and power imbalances, we won't be successful in our efforts. So since taking up that championship last September, the High Commissioner has focused on three main priorities: bolstering prevention, expanding safe spaces, and promoting a respectful use of the field. The issue, sorry, there's a lot of noise in the background, so it's difficult. If people could turn off their mics, that would be great. Thanks. So prevention, particularly in the context of COVID-19, is really important, and I really look forward to discussing that in more detail with you all later in the conversation. So in terms of the actual initiatives that the High Commissioner has been involved in and that we've been collaborating on together with you, I wanted to start off by mentioning the PSEA Communities and Community Outreach Fund that we've launched together with ICFA under the IASC. It was officially launched on 15th of April, and it's already generated fantastic interest. It's predominantly for small NGOs to develop essential information on education and communication materials and approaches on PSEA that are tailored to local context, operational realities, and then those most at risk. So we're really excited about the strong interest. Already we have almost 80 submissions and lots more interest. Don't be daunted by the numbers applying, please apply. And we think this is a very exciting initiative, which we hope will support your work in the field. Another initiative that we've launched is a communications package on sexual misconduct for use by the principals. The idea is that when the principals of our agencies go out and make field visits, it would help them facilitate a conversation with all of you in the field. So it also includes an interesting video and some other materials. Unfortunately, due to COVID-19, they're not traveling in the field at the moment, but we think that these materials can also really be easily adapted to a virtual conference, particularly the videos. We're also preparing investigation e-learnings for partners. So that's in the finalization stage, and we hope to make it very interactive as well and engaging. So we're working on that part. We're also collecting information and materials to provide examples of good practice on culture change initiatives. We've reached out through the IASC, but if you have any more examples, please continue to forward them, because we're not going to get at those underlining inequities, power imbalances from which sexual misconduct stems, unless we are able to look individually at ourselves and at our organizational cultures. And finally, last but definitely not least, is an interagency face-to-face learning package for partners on sexual misconduct. It was just finalized and it's going to be launched next week. It's called Saying No to Sexual Misconduct. It's based on a very interactive package prepared by IOM on SEA, and it was adapted by ourselves, IOM, and WFP, with wide-ranging contributions from OCHA, UNICEF, ICFA, CHS Alliance, and NRC, and funded by the High Commissioner under his championship. So you can see a picture of it here. It's going to be formally up on the OCHA website on the 13th of March. And then there's going to be a series of webinars, including, I believe, a webinar about it on the 19th of March. It was designed as a face-to-face program, but there are aspects that can be delivered virtually, so we'll be discussing that in the webinar. But pictures speak louder than words, and videos speak even louder than pictures. So what I'd like to do now is share one of the videos from the package, and to interest you, and then to encourage you to come and see next week when we present the whole package. So I'll stop here and hand it over to you, Wendy.
Thanks. So we're going to show you a video now, and I'm giving it over to Young to show it. Just to remind everyone, the packet is going to be launched on the 13th of May. So sorry for those. I hope some of you were able to see that. I'm getting some great reactions in the chat box. I know that some of you did have problems seeing it, but we will make it available online. I now want to ask Andreas from WHO if you can give us your reactions. I know you haven't, it's your first time seeing this video. What did you think?
Well, thank you, Andy, and thank you, Diane, and everyone who's showing this great interest in this very important webinar. The video is quite powerful and, if I may say, also disturbing to the extent that without showing real-life persons, but just cartoon means basically very clearly displays various settings of abuse of power, in particular those that result in forced sexual interaction. Which is what we are talking about today, and which is what unfortunately is happening, still happening, even though years and years have passed since I was first involved in PSEA investigations in 2004. Still happening too much in humanitarian settings, and exacerbated in situations where there are some groups of people that are vulnerable, which is the case in humanitarian settings. It is atrocious to still see that this kind of behavior even though you know we are past the stage where the UN was in strict denial of PSEA, is still ongoing, and it's our common objective to fight this common enemy. So thank you for showing this video, Wendy, and creating a very powerful impression, particularly with a focus on when abuse ends. And the situations may end, but the experiences and the feelings, I think, never end. Over to you, Wendy.
Thanks, Andreas, for sharing those reactions. I can see that many people also agree that this is a useful video to start off a conversation when we're doing the training. I think it is useful that there is resources available when we screen the video to answer some of the questions that maybe the video would provoke. Now, just turning to what's happening currently with the COVID-19 response, and there's a lot of concerns about how this might affect our current operations. Do you expect to see an increased risk of sexual exploitation and abuse during the COVID-19 response?
Yeah, thank you, Wendy. I think this is a very pertinent question, and WHO is sort of in the center of the immediate declaration of the.
Sorry, Andreas, hold on. I've accidentally muted you. I was muting everyone else.
Sorry. So can you hear me now?
Yes.
No, thank you, Wendy. This is a very pertinent question, and it's very important because we are dealing with a situation where WHO has, Director General has declared a pandemic. Member states are reacting in different ways. We are seeing it here in Geneva, but I'm very pleased to see so many colleagues from countries in humanitarian settings online responding here to our call, and that's great. I would like to say that the discussion very much focuses also in WHO on how to fight the virus, but then also how the measures that governments put in place to follow the recommendations of WHO could also have negative consequences. And to answer your question regarding the risks, it is true that in emergency settings such as the COVID-19, vulnerable groups become even more vulnerable. I would like to exemplify this with 3 groups. There is, of course, the children that often are abused under sexual exploitation and abuse in humanitarian settings where there are curfews in place, where social distancing measures are put in place, where stress is also put on communities. It is often seen that there is a lack of care, a lack of schooling, the attention of caretakers of children decreases, and then basically obviously makes this group of already very vulnerable members of society even more vulnerable. Women, often mothers, in many settings that you on the line know very well, are providers of food, are providers of resources, providers of water. The scarcity of such resources and their particular importance, in particular with regards to water, under the hygienic recommendations of WHO, makes them even more vulnerable because they are exposed, they have to go where no one else goes, and they are very vulnerable in these situations. This is exacerbated by the fact that we see new groups of responders moving in. Government officials have even more power now than they used to have before COVID-19 because they can enforce certain measures such as social distancing and others. And they might do so, as we've seen in the video, sometimes with means and measures that are basically under the code of under PSEA. I would also like to turn to a second group of vulnerable people that is very much you wouldn't consider as vulnerable: the frontline workers. In many humanitarian settings, the frontline workers are women. And they are basically providing services. They may find themselves in situations where they are stressed, where people who come to them are stressed, where they want something, where they will ask for something in return. And that puts the group of people who are very much at the core and heart of WHO very much at risk. I would also like to emphasize that in other humanitarian settings, the restrictions that are imposed in terms of curfew and staying at home orders can, and we've seen this not only in humanitarian settings, but generally can increase domestic violence and the effects of exploitative relationships. So I would like to focus on these 3 groups and you in the field, and I'm very much looking forward to your questions, I think can relate that these are three groups that under the COVID-19, not just in response to the virus, but because of the measures imposed by governments and recommended by WHO, are more vulnerable. Thanks, and over.
Thanks, Andreas. Maybe I could turn to you, Diane, and ask you if you have any additional ideas of what actions could be taken during the current context, specifically maybe some examples from your field colleagues, and if you could focus in on what support or tools are available for colleagues in the field who are working to prevent and respond to sexual exploitation and abuse in the current context.
Okay, thanks a lot, Wendy, and really sorry for the colleagues in the field that can't hear. Wendy has mentioned that this will be recorded, so you'll get to see it again, and we welcome further opportunities really to dialogue with you. So I think Andreas has highlighted some key points, and also really the criticality of making sure that we do address the risks of PSEA in the health sector with communication materials, with having PSEA focal points in the sector. But it's equally important to include PSEA in other sectors where it might not be anticipated. So include addressing PSEA risks in multi-sectoral needs assessments, humanitarian response plans, and other planning frameworks so that we can ensure that our programming minimizes the risks of PSEA in all sectors. Because there's a tendency to focus on it in the protection sector, but we also need to look at basic needs, food security, shelter, health, and wash. And also cash. Because right now, cash is a really critical area. It's being ramping up, so we meet when we aren't able to deliver in-kind assistance. So that's a really particular area. I know WFP is working on it. We're engaged with them to really mitigate the risks of abuse of power in cash. And then, of course, critical to prevention is empowering refugees. So in particular women and girls, so that they can directly and independently access the information, and then that risks exploitation and abuse by middlemen. And there's some really interesting work going on in the field, helplines and email accounts, for example, in Uganda, so that refugees can directly access the information themselves. Afghanistan, Myanmar, Iraq, Kenya. There's really lots of ideas coming up from the field, so I really hope people will share it on the chat. And also, obviously, ensuring that women and girls are fully engaged in decision making and in programmatic responses. So in these times, the more we can focus on prevention, the better. We can't forget about the response. So we need to look at business continuity plans. If our regular reporting mechanisms aren't functioning, then we need to look at alternative mechanisms. And obviously, we still need to really prioritize access to services in broader SGBV programs and child protection programs, and make sure that these broader programs are fully funded and also they cater to the needs of victims of SEA. And just very quickly, turning on the tools, because I know we want to get to the discussion. We've already mentioned two tools. One is the learning package, and the other is the communications and outreach fund with ICFA. So we hope those will be really helpful tools. I know everybody's aware of the guidance note and the letter that went out. Hopefully, if you aren't, we can share, that went out from the High Commissioner, the Emergency Relief Coordinator, and the Victims' Rights Advocate, with some key steps that should be taken in relation to prevention and response to SEA. We're also working to develop a 5-point checklist. And I know, as always, the colleagues on the ground are ahead of us, and we have some really good examples of tip sheets and checklists that we're looking at and try to incorporate in something model. And then finally, I'll mention this common assessment tool that we're cooperating with other UN agencies, UNICEF, WFP, UNFPA, and OCHA, and in close consultation with our NGO partners to support compliance with the UN protocol on preventing SEA. So We really want to work on that together, so NGOs won't be required to comply with different tools from different partners. We're really, really trying to work collaboratively here. So I will stop there.
Thanks, Diane. That's really helpful. I'm seeing some comments also in the chat about the difficulty of accessing services in the current context. And so I wanted to turn back to Andreas. I mean, your experience with WHO responding, for example, in the Ebola response or other public health emergencies, is there any specific guidance you would give for people that are concerned about how they set up their health services or accessing health services in this time?
So I think, thank you, Wendy. I think these are very pertinent points, very important to the truth of the ground. And that's basically where the rubber hits the road. Health services, of course, we have some experience setting it up in Ebola. I think you all know that there have been two different settings in 2014 and in 2019. What is important is what Diane already mentioned, providing equal access. Then, of course, you know, we have to make sure that those people who provide the services and are screened and selected to be there working in the setting basically do so equally, fairly, and justly. They have to be selected in a way that is transparent and makes sure that, you know, all background checks are taken into account so that nobody with an SEA background is basically recruited in this context. It's important that in the health facility, communication material is available that clearly sets out zero tolerance for sexual exploitation and abuse, and directs people who are experiencing or have witnessed or have seen something like this to the right tools, channels. Hotlines don't work everywhere. Word of mouth oftentimes is the best way of communications. And it is therefore most important from my point of view, and I think that is the key lesson from both Ebola 2014 and Ebola 2019, engage with the communities. Diane said this already, engage with communities, engage with the women. If you don't have a trust, if you're just working in an isolated setting, that will be very difficult to credibly convey the message that we are combating, as Diane was saying, jointly, not just as HCR, not just as WHO, this scourge. And lastly, I would also say my experience from Ebola is when Ebola spiked back again, one was because of unsafe burials, because it was a problem of community engagement. The other was lack of security. We've seen the curve going up whenever the rebels hit our health posts in Kivu. So that means that we have to also make sure that as a UN, with the solidarity of member states, we provide the adequate security to our health posts. These are, in a very broad nutshell, our lessons learned. Thank you, and over, Wendy.
Thanks a lot. Thanks a lot, Andreas. I just want to go over to some of the questions we've received in advance of this webinar through the email request. And one was about how we've stepped up assistance in certain areas, especially shelters, giving out non-food protective equipment, etc. And sometimes we're not working through our traditional partners. They're shelters run by communities. And the question is, what guidance would you give to manage if there is an SEA, a report of sexual exploitation or abuse in those contexts? And I'm going to hand that over to Diane if she could give us her perspective.
Thanks a lot, Wendy. So yeah, that's a very interesting and really pertinent question, because these shelters are playing such a critical role in relation to preventing the transmission of COVID-19, and it's great that you're doing this work with them. I mean, obviously, I think the first thing is to really be able to ensure that the victim gets access to services. And hopefully verifying that the services remain functional and reachable. And then second, I wouldn't just necessarily, you know, stop in-kind assistance, because this could disincentivize reporting, and it could also create other risks, including relations to COVID-19. So I think then you need to look at, you know, how the assistance is being delivered, and are there ways to address the risks of SEA, such as the proactive recruitment of women, in terms of the distribution, or looking at, you know, distribution lists, who's managing them, monitoring afterwards. So lots of those are some of the ideas. And then obviously, if it's really structural in there, then you might need to have a suspension in order to ensure that the structural risks are there. So, and this really applies not only just to shelters where they're not our partner, but could apply in relationship partners as well, although we're also governed obviously with our partners by our PPA, by our agreements with them and the requirements in there and under the protocol, and to report to us and carry out investigation. I hope that's a bit helpful.
Thanks a lot, Diane. Thanks a lot, Diane. We also had a question, Andreas, about how government staff are often the frontline workers in the COVID-19 response. And they were asking about any good examples of how the UN is working, or WHO in particular is working with government during this time.
That's an excellent question. It's a tricky one too. As you know, we work with 194 governments, and we have representatives in 150 countries. So it's really important. I mentioned in the first question when you asked about the risks, that government officials can put risks to vulnerable groups, but government officials also in the COVID-19 response, let's face it, can be subject to specific risks, both COVID-19 and otherwise frustration of the people. What we are doing is we're developing a training program for government officials. Of course, we're trying to focus it broadly because COVID-19 is different from Ebola in as much as it does not apply in humanitarian settings only, but it has a global reach. That's very important, and I'm happy to make this available. Awareness campaigns are very important. Ultimately, that's a topic, Wendy, that is very hotly debated within WHO as well, because we are definitely trying to hold governments accountable as well. On the same token, I think it is out in the public domain how WHO itself is also subject to criticism from governments. So we have to be extremely diplomatic. We're working with governments. We are negotiating safe access in settings such as Ukraine and others. I cannot give you this one super example where everything is working perfectly, but the issue that's been raised, I think, from Myanmar, from a colleague in Myanmar, is very pertinent, not least because, amongst others, as you know, WHO recently lost a driver due to an attack in Rakhine State in northern Myanmar. So we are working on this. We are aware of this. We are a bit in the conundrum here because we are both trying to promote the right action, the right behavior, and we are trying to respond to criticism as well. Thanks, Wendy, and over.
Thanks very much. We are now more than 400 participants on this WebEx. So I'm trying to go through the spray that is the comment section. There is a question also about specific guidance, and it's related to the earlier question in quarantine sites, if there's any specific guidance on how we can better prevent and protect from sexual exploitation and abuse in some of the quarantine sites. So I don't know if Andreas or Diane, you'd have something you'd like to add to what has already been said?
Maybe Andreas should go first, I think, because it's about the sites.
Well, thank you very much. That's exactly thank you, Dan. Thank you, Wendy, and thanks for the question. That's a very difficult question indeed. We do have, the general guidelines of WHO in COVID-19 and quarantine, and we're trying to square the circle and make sure that we at the same time protect people from COVID-19 and we protect vulnerable groups from PSEA. And sometimes these two objectives can not necessarily are mutually exclusive, but they are very, very difficult to reconcile in some settings, as I said, where government officials or others play a specific role. We have, of course, guidelines for how to behave and act in quarantine settings. I have to put some more drive behind how we basically tailor them to addressing a PSEA, but I can only tell you that this is an extremely difficult scenario, an extremely difficult question. At this point in time, probably WHO senior management puts its emphasis on fighting COVID-19. But I'm happy to, because I know Diane works, and her office works a lot in refugee settings where quarantine poses particular problems, where water is not available, water is a scarce good. So Diane, if you have any additional suggestions, please.
Okay, thanks. I mean, some of it's in the guidance note about the importance of, training healthcare workers even in those sites, and ensuring that information is available about how to report. It would be good if there could somehow be some kind of telephone, because there are still the helplines that are functioning. So perhaps if there could be some telephone access like there is in some countries, having PSEA focal points within the sites is very important as well. And then really, again, going back to engaging with the community, discussing with the people in the sites, how they be, what measures they think would be most appropriate to them. Those would all be quite important steps, but is undoubtedly a challenge.
Great, thanks for that. And I also see that there's been some exchanges in the chat between participants on the line that have resources and others asking questions. So we will make available the resources that we've referred to during this webinar on the interagencystandingcommittee.org website, and we'll also make available anything that's shared with us through the IASC correspondence at un.org email address that was in this invitation. So if you do have some good examples you'd like us to share with this audience, you can do send it to us. We'll put the email address again in the chat box. I had a request from Ellie Gass from World Vision, who wanted to speak a little bit about the NGO perspective. So Ellie, if you're online, you can unmute yourself and just come on in.
Thank you very much, Wendy. I just want to share with you the experience from the NGO perspective. I agree with the presenters, and I really want to highlight the fact that COVID-19 has affected so many, especially the most vulnerable communities. And when we are putting a lot of emphasis in emergency, and that makes a lot of sense, it's in refugee camps and IDPs. But I want to also mention that the development programs are affected as well these days, especially when you look at the lockdown or people are requested to stay home, they get more vulnerable, they are hungry, and therefore they become very vulnerable when there is any distribution that is done by either the government or civil society organization or NGOs, even by other agencies, including the government. So when these distributions are done, they become very vulnerable. We noticed this in World Vision. We started our response with 28 countries. Now we're expanding it to almost all our operations in all countries to make sure that in all countries, our field offices are prepared, understand the risk, and they give an opportunity for children, adults to basically have rooms to exchange their concerns. Wherever they are not happy or they see something that is not working, to report it. In the past, a number of civil society organizations or NGOs, these things that they are doing well, including us as a Christian organization in particular, we felt like, we are doing well, we are Christian, we cannot get abuse of children, abuse of women, so we thought we are okay. But over time, we discovered that at the end of the day, the vulnerability is there, and we started putting in place mechanisms. And this basically shifted our reporting.
Thanks, Ellie.
300%. So that explained again the need to make sure that we really put an emphasis during this period, in particular, where children, adults are becoming very vulnerable because of COVID-19. That's what I want to share. Thank you.
Thanks, Ellie. Thanks for that perspective. And we do recognize that addressing some of these issues will require us to work more closely with the development community as well. And you'll notice that in the larger response, we are trying to do that. given that many people have another commitment at 4 o'clock Geneva time, I wanted to kind of move towards some last questions that we received in the chat as well as online. And that is any additional advice you would like to give to colleagues regarding engaging with communities in places where there might not be already some networks in place. I know there is an initiative that's being stood up with Goran. Andreas, I'm not sure if you're aware of it, the Risk Communication and Community Engagement Initiative, and maybe you'd like to speak to that.
So as stated, this initiative within Goran is very important, and I think it's important that we've managed to put this on the map as a risk item, also in WHO, and it's very important that the community engagement is emphasized. I think WHO can benefit from its experience in the Ebola response there, but others like UNHCR are even more ingrained and have this. So it's important to keep this, to use the community engagement even in settings where social distancing is in place and where limitations are in place. That affects all of us. I'm happy to share offline, but I think it's a very important point that you're raising, Wendy, and fully supported by us. Thanks. Maybe Diane has an additional deliberation on that.
Sorry, everybody. I think that Grania put some interesting information online, actually, about that, and our work with affected populations and outreach to them. So I'm quite happy if colleagues, I know that our colleagues that are focused on this are there, so maybe I could give the floor to Grania and she might want to say a few words about that.
Hi, Diane. Hi, Wendy. Good to see you again. Thank you, Diane. You're just a cunning way to stop my manic typing on the chat box. Listen, there's a lot can be said, and I don't certainly claim as UNHCR that we are more advanced, better, or more successful than others. But the one comment I would like to add that I just put up on the chat box was, when we talk about engagement with communities, this is not an easy task. And we have to be willing to go the extra mile to make sure that our engagement is done through an age, gender, and diversity lens. Because often under pressure, and particularly so in COVID, when, as so many of the comments reflect, we don't have the immediate face-to-face access, but we do still have to go the extra mile to make the effort to ensure that an age, gender, and diversity approach ensures that we are really reaching out and understanding the interests, the needs, the rights, the concerns of different parts of a community, because a community is not a homogeneous thing. And oftentimes under pressure, we take the shortcut and we reach out to community structures which are not always the most representative and not necessarily always the fairest to the needs and rights of maybe marginalized or invisible segments of the community. So it's a bit counterintuitive with all the challenges of COVID, where we're trying to find the easiest and quickest ways to engage, especially for agencies or activities that have not previously had a very community engaged, community empowerment lens. But we really do have to take the time, age, gender, and diversity, listen and talk to different segments of the community, or we may risk on doing our own central commitment to do no harm in trying to take shortcuts with community engagement. Back to you.
Great, thanks, Grania. Again, we will be making available the tools that we've referred to, and especially the learning package, which will be made available next week. It will be available eventually in multiple languages, and the great thing about the learning package is you will be able to adopt the material to local context, and it's very key. That was a critical point I've seen in the chat about making sure that it is culturally specific and adapted and accessible to different age groups and different communities. So given that we're almost to the end, I wanted to just give the floor back to Diane for some key takeaways that you want to leave us with, and then I'll ask Andreas to do the same.
Okay, thanks. Thanks a lot, Wendy, and thanks everybody. I wish I could follow the chat and the others. Just to add quickly on the points, you have a lot of interesting tools out there. You're doing amazing work. So I'm wondering, Wendy, if people, because everyone's saying send it this email or not, if they could send it not to load your inbox, but if they could send it to, if there's an email that they can send it to, and then we can upload it on the site. And I know work is ongoing on that in results group 2. Actually, I believe that UNICEF is leading on that to have a platform. But I think there's some urgency. So I think we can find a way now that we've all become much more expert at technology. Thank you, Grania. So that was nice because Grania's remarks would be one of my key closing points. We always think that we need to kind of have the solution, but it's really about consulting with the diverse groups, and in particular, in this context, women and girls, to find the solutions to the challenges that they're facing. And that has to underline everything that we do, and also include, in particular, women and girls in planning and programming. And the second thing is, I think we need to realize also what Grania said, is that there is limitations of what we can do. So really, the more we can focus on prevention and risk mitigation, I think that's quite important, and monitoring what we can. And finally, just to say, to continue sharing these experiences from different operations, what's working, what the challenges that we face, to look at how we can really reach out and facilitate this cross-fertilization, because there's a lot of great examples and practices here. So thanks a lot.
Thanks for those reminders, Diane. Andreas, something you'd like to share with us? Takeaway?
Thank you, Diane. Basically, picking on what Diane said, I think it is an extremely strong message sent here through the IASC, and thanks to Wendy and team, because as you said, Diane, this is a collaborative effort. Nobody of us can do it alone, but all of us are affected by what the other one does, including NGOs. So collaboration, collaboration, collaboration. Second point is accessibility of tools. Thanks to HCR, Championship of the High Commissioner, we have tools. We just need to make them accessible. And we need to make sure that everybody, and I think that's what I've been reading on the chat box as well, is eager to go for that. Third takeaway, community access. We have a long way to go on it, but it's been highlighted in the last questions, and it needs, we need to engage stronger, more vigorously, and without compromise with communities. And then that is also a call to WHO. Fourthly, WHO, we focus a lot on COVID-19. We have a lot of funding coming in right now for solidarity fund and stuff like that. The focus is on a vaccine, the focus is on healing, the focus is on also preventing through a vaccine, medication. All of that is very high on the agenda. It's very important that we don't forget corporately encompassing issues such as PSEA, and also include them in the funding, and I'm trying to work on that, but it's not easy. Lastly, a point that wasn't mentioned here, but that's very close to my heart. When I speak to investigation colleagues who ultimately do the investigations of allegations of sexual exploitation and abuse concerning at least the UN entities, many have been basically called back, repatriated. So they are now, in their hubs, at least as far as WHO is concerned, but I understand also, I hear this from sister agencies and funds and programs. So that is one more risk that I forgot to mention in the beginning, but we're seeing a disparity between where the action, where the risks are, and where the resources to mitigate the risks are. There are many more things I would like to say, but I think I'll limit it here, and thank you very much for your very thoughtful contributions and incentives for further discussion. Thank you, and over.
Thanks so much for your time and words of wisdom, Andreas. I'm going to, Diane had another point that she wanted to make, so I'm going to hand her the floor.
Yeah, I just actually wanted to thank everybody that's here, because the number of people online and sharing is really amazing, and I think it's really reflective of the commitment of everybody. in a really difficult time when you're focusing on many things in the field, including preventing COVID-19, to really keep this at the forefront. So it's really great, and I hope that we can find really more important ways to dialogue. But I just really wanted to thank everybody and for their engagement. So thanks.
Thanks, Diane. Thanks, Andreas. Thanks for all of you who are online. I have a few announcements that this webinar will be made available as a recording on our interagencystandingcommittee.org website, along with the guidance and initiatives we referred to today, and that we will be launching this training package, which features the video we screened earlier, next week, Wednesday, 13 May. So watch this space. You will also be able to see the upcoming webinars, both on protection from sexual exploitation and abuse, as well as other webinars on COVID-19 guidance. If you look at that website, interagencystandingcommittee.org/events. And then those of you who wanted to see the video again, we will screen it one last time for those who missed it and were unable to see it. And for all the rest of you, please stay safe and be well. And thank you for joining us today.
Thank you, Wendy. Thank you, everybody.
Thanks.
Cheers. Thanks, Wendy.
Thanks everybody.